Good morning, everyone. It's Thursday, September 24th, and this is our coronavirus update from Midland Health. I'm Russell Myers, CEO of Midland Health. Starting with some numbers statewide, total case count now is approaching 720,000, over 15,000 deaths in the state to date. Here in Midland County, 3,588 cases and 82 deaths so far during the course of the pandemic. The hospital census has been high and continues to be so. 173 patients, today. We've been very full in critical care, and a number of days recently have had to put off transfer requests, or on occasion just have day-to-day expectations for those restrictions. But as of today, we have 11 patients in critical care. We have 7 COVID patients total, 3 of those critical care and 4 of them in the medical unit. We're down to only 1 patient from the Ashton Medical Lodge now, as that outbreak seems to be under control. Among our employees, we have only 4 that are known to be COVID positive and are being quarantined. We have 4 other employees who are in quarantine for other purposes, and a total of 13 who have had some level of exposure and are self-monitoring but not in quarantine. In testing news, the test volumes have gone up. Have been trending up the last few days, about 70 a day here lately. The positive percentages are also going up. Last week's, after 2 weeks ago being down as low as 8%, they were back in the mid-9s. So far this week, we're over 11% of those being tested who are positive. That's potentially significant. We know this is a time of the year when we were expecting to see at least a small uptick, as the Labor Day exposures have now had 10 days or so to incubate. We're also testing more people, which you would think would drop the percentage positive rate. So that we're going in the opposite direction there, and that's interesting. Certainly not long enough to be a trend, but we're watching. We're in the 11+% positive range this week so far. We've gotten positive results from a few places where there are congregations. The Rock House facility is one. The jail is another. There are a few positive tests in the jail, and we've been talking to jail leadership about how best to manage those issues and keeping an eye on that. So far, no hospitalizations from either of those settings. The last thing on testing is school-age kids. So far in our testing sites, only 3, all of them in the 14 to 17 years of age grouping. Only 3 positives so far since school return has been underway. I'd like to remind you that flu shots are available now in the community. We have published some information, and is that available on our website now? Where there are multiple locations around, we put a few of them up on our website. We're vaccinating our employees this week, and we'll get most of the workforce done. The vaccines have been available to patients who are inpatients. We have protocols for the delivery of the flu vaccine to inpatients, and we're carrying those out now. There are multiple different versions of the flu shot. The one I got, because I'm over 50 years of age, this year happens to be the one that is egg-free, and I don't remember an egg-free vaccine in the past. So anybody who's had challenges with egg allergies or reactions, there is now a flu shot available for you that will avoid those concerns. So we still encourage people to get a flu shot this year. That question has come up a lot. It is possible, as we understand it, and there apparently have been a few cases in other places where both COVID and flu have been positive and coexisting in the same patient. You can imagine that'd be a particularly difficult case to manage. And so let's manage what we can. If you possibly can get a flu shot, then get one. Let's avoid or mitigate flu symptoms, especially while we're in this current condition. We've got a couple of things that are coming up next week that I think are important. The state's order, emergency order that the Department of State Health Services issued restricting visitation in hospitals is expiring next week. And I do intend to have another Facebook Live session on Tuesday, and we should be able to give you the exact details on how we're modifying our visitation rules. We're talking about those a little bit more today, and by next week we'll be able to give you full details and probably implement those next Wednesday after the state's order expires. In all likelihood, we'll be allowing a single visitor for the vast majority of our patients, both in and outpatients. That's an expansion from the restrictive visitation that we're doing now, and we're hoping to have that in place, announced next week and ready to go by Wednesday. In addition, we're talking a good bit among our physicians and especially our outpatient practices about what protocols ought to be appropriate as we move into respiratory disease season. Not only is COVID still present in the community, but we have the flu, we have RSV among children. There are challenges in distinguishing among those disease processes, and we have some ideas about how best to test and evaluate patients to give our doctors guidance on treatment regimens that might be appropriate depending on lab results, and also to keep patients safe as they come into our physicians' offices, as they wait for appointments, as they're seen in exam rooms. Lots of really good ideas in the works. So far, our physicians report that the process of going to the physician, the patient visits, have been particularly safe and handled very well. For the most part, physicians affiliated with the hospital are asking patients to wait in their cars and not using their waiting rooms to much of an extent, asking them to come in alone to the exam room so we don't cram small exam rooms with multiple people. We expect we'll continue some of those ideas and expand on them as respiratory disease season comes along. So more on that next week as those ideas are more fully developed. And we'll be offering that guidance not only to the people in the community, but to all of our physicians who would be interested in what the hospital affiliated practices are doing. Let's see, I believe that is all that I have on that. I'd like to call on Tasa now to give you an update on our virtual wellness tour. Tasa, all yours.
Hey. Thank you, Russell. Good morning, everyone. We are very excited that we're able to kick off our 6th annual wellness tour on this past Tuesday of this week. It's a week full of health and wellness events for our entire community, and it's focused on bringing in the whole family to health and wellness conversations. This year, it does look a little different. It is all mostly virtual, but I'd like to take this time to thank our partners that helped make this happen this year. The City of Midland, MISD, and Keep Midland Beautiful. Without them working alongside us, it wouldn't have been possible this year. So thank you to all of them. We do have events that continue through this week, and they go through Saturday. So please visit midlandwellnesstour.com to look at all the details. We hope to see you out there.
Thank you, Tasa, very much. That's a great event we hold every year. We've been fortunate over the last several years to have been able to partner with the city and the schools and others in the community. And you know, we're doing it less in person this year, as we are doing most things, but still has lots to offer to everybody in the community as you strive to make your life healthier. So that is the extent of our prepared remarks, and we're prepared to take questions if you have them.
We have a question from Facebook. Is there an immunity once positive to COVID-19?
Is there an immunity once positive to COVID-19? That has been an interesting question that's been asked for a long time. I think there's uncertainty around that. Most patients develop antibodies. Our source of convalescent plasma, which is one of the treatment regimens we use, is patients who have recovered, developed antibodies in their system, donated plasma so that those antibodies can be given to other patients. Is there certainty about immunity post recovery? I don't think there is. And we're still learning about how long those antibodies last and how long they're effective.
Some people may not have antibodies and still have immunity by a different pathway.
Some people may have other pathways to immunity. I don't know that we've seen anybody reinfected in our community at this point. There are a handful of stories about secondary infections around the country, around the world, but still the jury's out on whether immunity lasts, well, how long it lasts, essentially.
We have a question from Stuart Doreen from the MRT. Has the school district reached out about the increasing numbers on their campuses?
We are sort of in continuous communication with various school officials. I know that Val Sparks and her counterpart in the health department within the schools talk regularly. We're not really involved in the decision making at the school district, and so what I understand that they are actively discussing now going back to full classrooms, full schools, everyday school, but we're not really actively involved in that discussion beyond our regular communication with the schools around management of the disease.
He has a follow-up question. Did you expect a bigger Labor Day bump? It doesn't seem to be overwhelming.
Yeah, I would say that I did. I'm not sure we're past it yet. The 14 days post Labor Day is not until this coming Monday, so we're still a few days away from that. But yeah, I would say that I expected us to ramp up just a little bit more than we have, especially when you consider Labor Day in combination with some return to school, with some return to college, with a variety of opening efforts going on around the community. I'm encouraged by that. I hope that it means that our citizens are continuing to follow the careful social distancing guidelines, staying out of crowds, staying in ventilated spaces when they have to be in a crowd, wearing a mask, washing their hands. All of the measures that we've all been taking for several months now that have controlled the disease outbreak in this community to a great extent. As long as those things are still happening, then we can keep a lid on the growth. We're hopeful about that. And Labor Day, the risk isn't over yet, but it's been encouraging so far.
It appears that's all the questions we have for this morning.
All right. Well, we thank you for your attention. Encourage you to partake in any of the wellness tour activities that interest you. And we'll see you again on Tuesday with information about visitation changes and whatever other news there is by then. Thank you.